Welcome to Mom and Mind, a podcast about maternal mental health, discussing conception, pregnancy, birth, and postpartum. Real stories from moms and family members who have made it from struggling to wellness, and interviews with experts and advocates who work for moms and families to get the help they need. This podcast is meant to offer information and awareness and is not a replacement for treatment by a professional or professional training. Hi, everybody. Welcome back to Mom and Mind. I'm your host, Dr. Kat. I learn something new every time I talk with our guest for this episode. We are talking with Nkem Ndefo about resiliency and understanding how deeply stress impacts us in pregnancy and postpartum. Nkem has become a friend over the last couple of years, and she's just amazing. She understands the perinatal period, understands the impact of stress and trauma on our minds and bodies, and is actively working with communities in need of support. This is an essential conversation, in part because we all have stress, but in different ways. Some people have periodic stress, and for some it's ongoing. What we do know is that stress, depression, and anxiety can impact pregnancy, birth, and postpartum. Nkem uses a nervous system lens to look at how stress is impacting people, and she supports pregnant and postpartum women to expand their resiliency and resources. Nkem is the founder and president of Lumos Transforms and creator of the Resilience Toolkit. As a certified nurse midwife, Nkem holds a master's degree in nursing from Frontier Nursing University. She has extensive postgraduate training in complementary health modalities and emotional therapies. She brings an abundance of experience as a clinician, educator, consultant, and community strategist to innovative programs that reduce stress and build resilience for individuals, organizations, and communities throughout the U.S. She worked for California Maternal Quality Care Collaborative, researching maternal death outcomes, and served on the Los Angeles County Trauma and Resilience-Informed Systems Change Initiative Work Group. Currently, she sits on the Strategic Planning Committee for the Trauma-Informed Task Force of Greater Los Angeles. Let's meet Nkem. Welcome, Nkem. Thank you so much for being with us today.
Thank you for having me, Kat.
I'm very excited to share your brilliance with the audience. I've known you for a couple of years now and just in awe of the work that you do. And I'm really, really happy for everyone to know about it. So maybe just start there and let us know about the work that you do.
Thank you so much. I think we have a mutual admiration club going.
Oh.
I'm originally trained as a nurse midwife and actually had a home birth practice in Los Angeles area from 2001 until 2007. And then did some work in maternal actual mortality research. But one of the things that drew me to midwifery in the first place was I had originally, while I was in college, undergrad, done some work, community health organizing and health education, street-based health education with really vulnerable populations and feeling like I wasn't really making a difference. And I remember seeing pregnant women. I worked on a needle exchange to decrease transmission of HIV and hepatitis and seeing pregnant women come and exchange needles and how, I knew it was preventing her from getting infected, but how I felt so powerless about what else was going on and all the larger pieces. And I had my own child with a nurse midwife around then. And it was such a powerful experience that I said, that's it. It's not just giving education, it's empowering. So I sort of felt like I was going upstream towards more of the root of the problem. Mm-hmm. But in working as a midwife, really seeing that stress, toxic stress and trauma were actually deeper issues. And I think sort of one of the seminal events was working with a woman who had she was a labor and delivery nurse, and she had a really horrible first birth experience, just completely disempowering and just bed rest and just, OB not listening, just bad. And really wanted to turn that around with her second birth. And mind you, she was super educated. She was a labor and delivery nurse, and this still happened to her. Mm-hmm. And she wanted to turn that around and have, an empowering birth. And we worked really hard collaboratively, and she had the birth of her dreams. Mm-hmm. But what happened was afterwards, she had incredible postpartum anxiety, and realizing that her childhood, her experience of trauma, really, and as a child, exacerbated, through life, was no, giving her a positive, helping her achieve her positive birth experience was no match for what the forces she was contending with. And I think that encapsulates my wanting to work around stress, toxic stress, and trauma as sort of root causes for people suffering, especially around the birth, for moms and babies.
Right. Right. Absolutely. Wow. Right. So you started out kind of more on the outside of seeing what happens to birthing women, and going deeper, you got to the birth, and then you got to understand the full spectrum of how trauma impacts them.
Yeah.
And that is a lot of the work that you do right now, correct?
Yeah. So, probably for the last 10 years or so, I've taken a detour outside of clinical midwifery to really learn all I could about stress and trauma and different treatment modalities from a number of perspectives. Because I tend to be like, big picture thinker, but also very practical. Like, what are we going to do about it? And a lot of trainings, a lot of work with people. And I'm coming back full circle now to bring what I've learned into the space where the childbearing year, because I think I always knew it was important. Even before, this was before epigenetics, before we knew that there was, changes in that stressful experiences around in pregnancy can imprint the future generations. I feel like extra confirmed that, once the epigenetic, we now know that altogether, that this is a really special time in our lives, and it can really change the trajectory one way or another. And so bringing the work about building resilience, really, how do we build resilience for pregnant people and their families, right?
Yeah. The whole system there. And I really love that about your work, that you focus on the resilience and that knowing fully well that the trauma is there. But the resilience really focuses on the ability of people who've been through so much to keep going, and to hopefully, with your help, keep going in a more healthy or increased coping type of way.
Yeah, I think one of the things about healing, there's this idea that we have to tear things down. I think it's actually a pretty masculine perspective. Like, let's just tear down all this bad stuff. And I'm like, really kind of a firm believer, like, what can we build up, right? What's good? What's working? Because if we're all like here, something is working. It may not be much, but something is working. And how do we build on that? And how do we help draw out the strengths? And I always, as a midwife, we don't deliver babies. We hold space, we guide, and people deliver their own children. And I believe that there's strengths, there's like untold strengths within us, but having somebody help guide and pull those out. And then when you're in that place of strength, it's a lot easier to say, you know what, I'm going to dismantle this, or this needs to come down. It's not serving me anymore. But you're doing it from a resourced place. Like, I think there's an analogy I often give, which is that I think when we think about trauma healing or something, it's like people are drowning, or even if you're just super stressed out, you're drowning, this sense of like, I am so overwhelmed. And what if you saw someone drowning, you would never like say, just go stick your head further in the water, swim deeper. We would never ever say that. Instead, we throw them a lifeline. And so I think about the work that I do as helping throw people a lifeline to help them find, like, almost build an oasis, an island on those really stormy, turbulent waters. And, life will happen and it kind of pushes you down and you fall in the water again. But when you know how to get back up on that island over and over again, how to find that calm and that peaceful place within you, that strength, And the more often that you do that, you have a place of resource from which to explore the turbulent water, from which to operate. So I kind of think about resilience, especially in pregnancy. You don't really want to be digging up stuff. You don't do a detox in pregnancy.
Right.
You don't do it, in any way. You don't do that in the postpartum when you're breastfeeding. So it's about calming, stabilizing, nurturing, again, resourcing, looking what's already there and what can we add? What can we grow?
That's amazing. I really love that. And I feel like a lot of pregnant and postpartum folks who listen to this can resonate with the examples that you gave, because it's so powerful and it's so true. Just having a place of stability first is so important. It's so important.
Right. And even, if you have clinicians who are listening, I remember recently teaching a public course, and there was a mindfulness-based therapist in the course. And she said, she teaches mindfulness and she's a marriage and family therapist. And she said, I realize that I'm not actually paying close enough attention to my clients' nervous systems, and I'm pushing them too fast.
Yeah.
And I need to slow down the pace of what I'm doing. It needs to be more, there's a gentleness in the work that we do that I think comes from midwifery, about, I have found that by going slow and steady and resourcing, that you go much further. Like people are doing the best they can at any given moment. And so when you ask them to do more, they usually just collapse or shut down or have to compartmentalize or avoid because they need to survive. But when you resource people naturally want to do more. People are naturally curious. People are naturally, we grow, So I think following the rhythm of healing, where resource first, and then the challenge can come, right? Where, growth, the thing about resilience and adversity is we do grow. We do get stronger, but it has to be within our window of tolerance. If it's outside of our window of tolerance, it's too much. It doesn't cause us to grow. It causes us to break.
Oh, it's so true. And you mentioned the nervous system. And can you say a little bit more about how the nervous system plays a role here? So, one of the things we teach, and we teach this thing called the Resilience Toolkit at my organization. It's actually a program that I developed, and it comes through in part a nervous system lens, which is to say that, our nervous systems are, and it's more than our nervous systems is a controlling system of our body, but it communicates with our immune system and also with our hormone system. So the big controllers there, right? That these systems are there to keep us safe. And that when we feel threatened, they go into a defense state. And that defense state really shifts every single system in the body, mental, emotional, physical, how we relate to ourselves and others. Everything changes when we're in a defense state. So sometimes, like, for example, anxiety, I think is often mistaken. We just say, oh, I'm anxious. But when we actually look at somebody is in a defense state around, it could be something very legitimate to be afraid of. These are hard times we're living in. Right.
And if we name it as, can be a danger in pathologizing it, right? As saying it's a mental health disorder, as opposed to saying this is actually an adaptive response to a situation that a mom is dealing with.
Yeah.
A woman who was being, just to be, it's a little bit more extreme, but we have a program with pregnant and parenting teens. And some of them are homeless. They're dealing with some really incredible adversity and just incredible survivors they are. But when one of them says, I'm homeless, I'm on a voucher, I'm in a motel, and I'm feeling really scared and stressed, that's probably an adaptive response. And while we might say, yes, she's anxious, I would say it's a pretty normal response. Right. It doesn't mean that it can't be harmful. It doesn't mean that we don't do anything about it. But I think by naming it appropriately, like if we realize this young woman's situation is in part because of her environment, and making changes in her environment, I think she will be able to find more calm and stability. Now, if she was completely safe, right? If we take a woman who is completely safe with adequate food and a roof over her head and caring and loving people around her, and she is feeling scared, right? And we might say, I might look through a nervous system lens and say, maybe there was something historical where you didn't feel safe. And that worry that's there was actually very well placed and adapted for a past situation, but the body has become stuck in it and hasn't been able to appraise that it's okay now. And in that case, there is something we can do through a nervous system lens to downregulate or calm that defense response. Does that answer your question?
Oh, absolutely. It's beautiful. And just thinking of all of the moms and partners and people who are affected by these types of stressors, and the interplay with mental health and maternal mental health specifically. It's just, I just feel that the way you framed that and the way you look at it has just such a more compassionate understanding of someone's situation, as opposed to saying, adding sort of insult to injury, like blaming the person who's struggling for why they're struggling. Like, oh, well, you're this and you need to fix it. It's just making it worse. But you're saying, hey, this is going on for you. Right. And what are the supportive things that we can do to help you to heal through this?
It's looking at, what are the systemic factors and what are the individual factors. I think there's one of the most damaging things we can say to people is to hold them responsible for systemic factors. And I think it really is disempowering, and people are already carrying a lot. Yeah. But that's not to say there's not something we can do and there's not individual factors. I've learned this a lot in doing trauma work, community-based trauma work and individual trauma work, is that a lot of people say, oh, I don't have trauma. That's not me. That's somebody else. Trauma is an overwhelming experience, something that's just bigger than us. And there's little traumas, there's big traumas. I don't want to, minimize some of the true atrocities that happen in the world, but they're all relative to your ability to cope. So, what's traumatic for a 2-year-old when their peas touch they're tired and their peas are touching their chicken and they're completely in meltdown, right? As opposed to, your peas touch your chicken and you're, 25 years old and, laughing at a great dinner with family and friends, not a big deal. Right. So we have to look at what are people's past trauma loads, their stressor loads, their physical health, their support systems, and really let people define for themselves when something feels like too much. But I also find that sometimes the stories we have to tell ourselves so we can get through day to day, we have to say that wasn't that bad. Right. It wasn't a trauma. I'm okay. Right. And you can't force someone to say, yeah, it was a trauma. You can't. But this is another thing. When somebody is well-resourced, when we work on resourcing them and building strength and building capacity, they might say, you know what, now that I'm feeling a little better, you know what, I can say that was really bad. Yeah. And I would like to heal that. Right. Yep. So it's, again, that idea, you can't ask someone to do more than they can handle at a time. It's not helpful. It's not therapeutic. Right.
And there's already so much going on in the perinatal period of time that people are already trying to understand and wrap their mind around. And, depending on what their needs are, that might not be the time, like you said a bit earlier, to be digging into these traumas and sort of trying to force people on some level to understand they've been traumatized in the past.
I don't think you can force that conversation. It needs to be phased. It needs to be gentle. And we need to, again, I believe when people are well-resourced, they're naturally going to migrate towards health and do the healing work. Now, it just happens if you've got the bandwidth. It's making the bandwidth. And it brings up, I think about pregnancy, especially a first pregnancy, learning nutrition, learning about, car seat, childbirth education, infant care, breastfeeding. There's so much, and you're still, prepping your home and keeping money coming in because you're working. There's a lot going on, and that a lot of times I think this conversation around stress gets really pushed to the side as something extraneous. I think it happens in general, not just in pregnancy, in our culture. When I don't have time is what I hear. And truthfully, if
are you talking about the client or patient, or are you talking about their provider doesn't have time,
everybody.
or both? No, but nobody has time.
Nobody has time. The provider has all the, I've got to do X, X, and X, and this conversation and that, and I've got to check all the boxes, and I've got this much time to do it.
Yeah.
But it's our culture. It's culture of hurry. And what I have found in addressing speak personally about my own nervous system, right? My ability to settle my nervous system, things flow easier and I have more time. So it's actually a sign to me that when I'm hurried, it's a sign that I'm stressed.
Yeah.
It's not the result of being stressed. It's a sign of being stressed. And in that way, taking a pause, letting something, we use a number of different tools that I use regularly myself, using some of these tools, settling my system, and suddenly there's creative answers, time magically appears. It's kind of, a miracle. But so I think the culture doesn't recognize stress and doesn't want to, we just caffeinate it away. I think that of course means people who are pregnant and their caregivers. And it reminds me when I was practicing, maybe like 2002, we were doing in our home birth practice really, I think, strong nutrition education for our clients. And I was realizing that wasn't happening in the private obstetrical world. If you were on aid, state aid, you get, a dietitian, you get some education actually, but I may not necessarily agree with the way that they were doing, but you get something. In private obstetrics, you get none. And so I developed a whole educational program around nutrition and went and started talking to local obstetricians, and they looked at me like I was from Mars. Like, what? Nutrition? It doesn't matter. Literally, I was told it doesn't matter.
What? In 2002? This is not that long ago. Oh my gosh.
And so I think about that conversation then, and now we are clearly much more progress has been made. But I think that's the same thing around stress. People are like, we don't have time for it. It's not a priority. When in fact, we know, and the literature, scientific literature is very clear. In general, pregnancy aside, 70 to 90% of all doctor's visits or provider visits are due to, in whole or part, to stress. Most of our chronic illnesses are due in whole or part to stress, and many pregnancy complications, everything from preterm birth, low birth weight, all the perinatal mood disorders are highly correlated with stress.
And not all stress is the same stress.
No.
So, I mean, I'm just thinking of like the variation of stressors in people's lives. There's like day-to-day stress, then there's survival stress.
But it's the same. But the thing about it is they both are mediated through the same mechanisms in the human body. Your body doesn't do a different response. It's a graded response, but the response for survival is much stronger, but this response for small cumulative stress can still be quite similar. And I would, say it's pretty hard to avoid the news and all the things that are happening in the world. It just seems like disaster of the week. And so there's that is like this background noise, stressing people's, this sense of fear and lack of stability and safety is kind of, running a good deal of people's energy. So I find that as we work with people, they start to slow down, they start to recognize, they go, I didn't realize how stressed I was. I didn't realize how much I was in a fight flight state. You don't realize until you come out of it and you say, wow, my muscles are much more relaxed. I didn't realize all those headaches I was getting was due to. Humans are amazingly adaptive. I'm sad that we have to adapt to such adversity so often.
So I'm thinking right now about, let's say there's a pregnant or postpartum mom listening. who maybe identifies with having high levels of stress or all of the things we've been talking about. What do you do in the work that you do to get them connected to their resilience or to bolster their resilience?
I think one of the first things, which I've already, spoken to, is just starting to look a little bit at your environment and realizing that your response may be normal. That takes this weight off. Like there's like audible sighs, like, oh, like there's nothing wrong with me.
Right. Yeah. Right.
And that's huge because again, if you can take anything off the plate, a feeling of responsibility where you shouldn't have one, if you can take that off someone's plate just by that perceptual shift, that's huge.
It is.
So I'm going to, give a lot of points for that. The other thing is, I think, is starting to recognize people's own rhythms of stress and relaxation. A lot of times we can talk about, say, I often will start some of our classes with, how do you know when you're relaxed? How do you know? What tells you when you're relaxed is, what do you feel in your body? What do you feel emotionally? How is your mind? And we brainstorm this often. And you can literally see folks start to settle. And then you notice a yawn, and we talk about yawning being a sign that you're feeling safe enough that you can start to let go and relax. And so people start to recognize that they have this capacity again, because we forget, because no one ever asks this question. In fact, some people kind of scratch their heads like, really? And they can sink into it and pointing out that this is your, it's a biological capacity that you have to do this, right? And then we can talk about those other states of activation and what they look like and what they feel like, but then keep coming back to this space, whether we use breath, whether we use short mindfulness, I call them like little hacks, whether we use movement, and to come back to this place, right?
So if I can ask you, I'm thinking of like the very highly, highly anxious moms, the ones who kind of balk and laugh a little bit at me when I suggest breathing, because what they're going through feels so big in comparison to regulating their breath. Yeah. So can you speak a little bit to how and why regulating breathing and using mindfulness is helpful?
So, regulating the system, if it's appropriate, like if you're truly safe and it's okay, coming down it's really important, because that's when your immune system and all your body systems kick into gear the way they should be working to support a healthy pregnancy. So we know why it's important. The how of it, there are many different techniques. And I find, depending on someone's level of activation, they don't all work well.
Right.
So, and I think this is something that's not often talked about, and it's not so PC, but I'm going to say it because I see it. Often there's a gold standard of insight meditation, which means just coming in and noticing everything that's happening in your body. Truthfully, if somebody has very high activation, like very high, like kind of fight-flight energy, or they feel overwhelmed and shut down, I would not recommend that. Right. Because when they do, there's a reason why they're shut down, because there's too much activity going on inside. It's to ask them to then go into it often makes them feel worse. And so you'll hear people say, well, I can't meditate.
Yeah.
I feel horrible. And there's this value judgment, because meditation is good. So if it's good and I can't do it, I must be bad. And the shame vortex kicks in.
Yeah.
And what I say, and I say it over and over again, is meditation is good. There's nothing wrong with it. And you are good. There's nothing wrong with you. It's just not the right tool for you now. And that also is a huge relief in people. Like, oh, there is something. And so, same thing, certain kinds of breath, I find when people are really either numb and shut down in a sort of depressive state, or very, very anxious, often breath is not the best choice. It often can make people more anxious. So I think we have to trust people when they say that doesn't work for me. and say, what I always say is, I'm got so glad that you're realizing what you need. Right. And then let's try a different way to approach this. And so it might be, for example, orienting rather than turning inwards. Let's orient to the external environment. And, what are you seeing? What are you hearing? What are you smelling? And pulling in from the senses. And often people will say, that I can do.
Right.
And you may find is that from that settled place, and they do that repeatedly, and they're able to access that place more often, then you could try turning inwards and see if it works later. So I think being in partnership when we work with folks, listening to them saying what's working and what's not working, being creative, and because there's a lot of different tools out there.
And very specifically for maternal mental health, perinatal mental health, what have you seen, and how do you see that building resilience? And maybe this is an obvious question, but how does it help?
Well, I mean, I think if we look at the flip side, if we know what high stress does in pregnancy, what it does to preterm birth and those things that I mentioned earlier, it would be that we're not seeing those things, right? So we're seeing better outcomes. And we've started a partnership with a local birth center. And in 2018, we're actually going to be doing some research, really looking at length of labor, looking at transfers, looking at some of those things that happen related to if we're putting in these tools early in pregnancy. We're trying to get them in very early second trimester so that people have a chance to really put them into play. And this birth center is actually going to be, they do an anxiety screen at the second postpartum, depression and anxiety screen at the second postpartum visit. And so they're going to be, anyone who screens positive is with their partner are going to be coming to the classes. So we really hope to see,
awesome, not
just theoretically, but actually to be able to have some, hardcore data to show what we see it experientially. I remember teaching a pregnant woman who was pretty close to her due, about 38 weeks, I believe. And she, it took her a while, but she made it. And as we did the class, she said, I'm contracting, right? She goes, I don't contract. Everyone says I got to stay active and that will help me, have more Braxton Hicks and soften my cervix, because she's 38 weeks, she's term. And she goes, but I don't contract. But as I'm relaxing, I'm contracting. She's like, is this what needs to happen? Right? That she could sense into that safety, right? And let that happen. And when she stood up from she said, I think the baby dropped. Like the baby had been so high. And in a first time, we want to see the baby, drop and start, providing some kind of interaction, deeper interaction with the cervix, a couple weeks before your due date. And she stood up and she's like, oh, the baby's in my pelvis. But that's, just one example of when you can settle how the different body systems can kick into gear.
That's beautiful.
Yeah.
Right. And I mean, obviously I'm thinking ideally we would all be able to do that.
Yes.
On some level. And, just with the juxtaposition of how you were saying before, just this constant onslaught of the stress we have just from watching the news or hearing about things, and then our own history and then our family and all these layers and levels of stressors in our environment. What you just described, that woman's experience does feel like that little safe island, like she found that spot.
Yeah. Yeah. And I mean, you could just see, she just softened and we affect each other, right?
Yeah.
We really do affect each other. So we know, if we're highly stressed in pregnancy, it causes a change in the stress hormone system, the genetic expression of the stress hormone system in our children.
Yeah.
And you see many cultures, traditional cultures around the world where they talk about keep things calm and peaceful for pregnant women so the babies will be calm and peaceful.
Mm-hmm.
And I mean, that's before we knew anything about the science of epigenetics, where we know for sure that, children of extreme situations in pregnancy, like the Holocaust or 9/11, but in those situations, there are changes in the gene expression for the stress system, causing the child, basically high stress in pregnancy creates an experience so that the child's stress system is prepared to handle high stress. So they're coming into the world already defensive.
Mm-hmm.
And so what we can do, our effect for just our own health, but also sometimes we as moms can't do things for ourselves, but we can do them for our kids.
Right.
And, hopefully as we keep doing them for our kids, we start to be included in that container of care.
So all of what we've been talking about is so amazing and so essential. And I feel like everybody should be given this kind of information and these resources. And you do this as part of your work. So if people are interested in learning from you or holding a workshop or having you come out to them somewhere, can you tell us about what you do?
Sure. So my organization is called Lumos Transforms, and as we believe that we need more light in the world, Lumos being light. So we offer public classes in the LA area, about to add some in New York and Vancouver, because we have some staff there as well. And we do online classes because we've had requests and had people from the UK and Canada and Australia take our online classes. And they're done in small series because this is about it's not just about learning. Resilience doesn't happen overnight, and it doesn't happen alone. We doing them in very small groups, even the online classes are like no more than 8 folks, doing them together brings in these new ideas, these new ways of experiencing ourselves and safely trying out the different tools until, and then coming back a week later and saying what worked, what didn't work, how do you test drive that? What's practical. So learning to develop habits is really important. In terms of pregnancy and the childbearing year, we're offering classes. I think I mentioned we've partnered with Del Mar Birth Center in South Pasadena in the LA area to offer a week. It's a 2-part series once a month so we're very excited to be partnering. And then we have some programs with pregnant and parenting teens that are school-based or community agency-based. And, our organization works across sectors, and we work with a lot of professional, from social work to education, a lot of other, because we believe, just like you said, these are sort of life skills. And we imagine that as more people learn them, we're able to connect, because when we're in a settled place, we're all the things we want to be. We're connected, we're compassionate, we're motivated, we're vital. All of those things are sort of this natural outpouring of a settled nervous system. And the more people that can be in that place, in families, in workplaces, in organizations, we believe that we can create systems and structures that are more kind and sustainable and just.
Yeah.
It's like that's our idea. So we do believe that, and caregivers, like, if your obstetrician or your mental health provider is super stressed out, that, how safe can we feel if they're stressed? Right. So as for provider myself, I take it very seriously that I need to do this work if I'm working with folks.
Yes.
So on all levels, yes, more of that. And we train people to be certified so that it can just ripple. So it's
I love that. I love the work that you're doing. It's so important. And I'm so glad to have you on and share this with everybody. And if anybody who's listening wants to learn more from Nkem, I will have all of the links to her organization and social media platforms in our show notes. So
thank you so much, Kat. You really putting maternal mental health front and center, and you using an intersectional lens to do it. I and including so many different voices is so important that I feel really honored to be here in conversation with you. So thank you.
Thank you so much. That means a lot to me. I appreciate that. Thank you for being with us.
Oh, my pleasure.
Well, Mom and Mind listeners, what do you think? Doesn't what Nkem said make so much sense? I feel like this type of support is what is missing from perinatal care in general. I mean, you can imagine what we would all feel like if we had this type of support that Nkem was discussing, and not just for pregnancy and postpartum, but for pretty much everything. I love the resourcing that she describes and the island of security and safety before you go out and deal with difficult things. Taking it easy on perinatal women is just the right thing to do. If you'd like to connect with Nkem, you can find her on Facebook, Instagram, and Twitter at Lumos Transforms, as well as on the website lumostransforms.com, LUMOS transforms.com. I'll have all of this information for you up in the show notes so you can access that for yourself. If you know someone who could really use the support of this episode, please send it along. Links are available at momandmind.com. And please hop onto iTunes, YouTube, or any of the places you listen to this podcast and give it a star rating or review. That really helps others to find this valuable resource. All right, thanks for being with us. Until next time. Thank you for joining us today. If you or someone you know is having a hard time, help is available. Please look for resources for help at momandmind.com. Also, please subscribe and share this podcast. Together, we can support moms and families so that no one has to deal with this alone. Thank you for being a part of the Mom and Mind community.